Welcome to Longevity Now FL. I'm Luigi Fontana, professor and scientific director of the Charles Perkins Center RPA Clinic and Longevity Program of the University of Sydney. All opinions expressed in my videos are my own. So, important point that we made in this perspective article published in PLOS Medicine that I wrote with Alessio Fasano, Yap-Seng Chong, Paolo Vinés, and Walter Willett. We believe that universal health coverage should be a right of every human being. I hope you agree. But we argue that this is achievable only if we invest enough resources in preventative science and medicine. And not only, as it happens nowadays, in finding new pharmacological targets, because this is an approach that is only further increasing health inequalities between rich and poor people and countries. We believe that transitioning from a primarily disease-centered medical system to a balanced, preventative, and mechanism-based, personalized treatment healthcare. So if we transition from a primarily sick care system to a real healthcare system, these will reduce social disparities in health and achieve financial sustainability and universal health coverage for all. Yes, I think, this is an extremely important concept because, when I was in US and, Obama became president, the idea of basically the Obama Healthcare Act was a good idea in principle, but, is unsustainable. It's totally unsustainable. In US right now, between approximately 40% of the population is obese, another 30% is overweight, so 70% in some states of US is even higher. And these people, not only they have obesity, but they have, metabolic syndrome, inflammation, type 2 diabetes, insulin resistance, and cardiovascular disease, cancer. There is an exponential increase in dementia because for many, many, many years, these people are, eating extremely unhealthy diet with a lot of ultra-processed food, lots of calories, lots of animal products. They are mostly sedentary people, smoking and over-drinking alcohol and stressed. And all these factors, as I've explained in many of my scientific papers, they are just exponentially increasing the accumulation of metabolic molecular damage, leading to multiple chronic diseases, because this molecular damage is not targeted to one organ, but is basically across many systems, increasing the risk of diseases. So if these people, they're going to live long enough, they're going to develop, as it already happens, multiple chronic disease, and it's going to make the system unsustainable. So there is no way that, a country, even as wealthy as US is, can afford a free health care for everybody unless we are transitioning from a disease-centered medical system. In US CDC data nowadays, the US spends $4.1 trillion every year. 90%, so these are not my data, but they are CDC data, 90% of these $4.1 trillion is to treat diseases after they have occurred. The results are terrible. Is the most expensive healthcare system in the world, with one of the worst outcomes in the world, and life expectancy average life expectancy is declining. It's probably the only developed country in which life expectancy has been declining for the last basically 3, 4, 5 years, 2.5 years less, a decline of 2.5 years on average. That's huge. And that's because basically the system is a system based on is a sick care medical system. People, they are doing whatever they are doing without education. They eat unhealthy diets, they become obese, with all these medical conditions, and eventually they knock to the door of the doctor or hospital and say, doctor, I have this problem. And then basically what we are trying to do is to fix the problem with drugs, surgery, and other procedures. And this is totally unsustainable, and most importantly, has a huge impact on environmental health, the financial sustainability of the system, and inequalities that is growing between rich and poor people. So my point is that we have so many solutions that are based on sound scientific data that could transform our way of living and the sustainability of medical, energy, and many other systems. We have just to invest properly. So, when I was in US, most of the scientific grants were mechanism. You have to show a mechanism. So what is the target, the pharmacological target? Because again, the idea is that, we are going to find a drug for, treating dementia, cancer, cardiovascular disease, and many of these diseases. I'm sorry, I disagree. Of course, bad luck exists. And so, you want to have treatments if someone has some genetic issues or conditions, and, you want to treat them. But it's crazy, to think, you're going to treat every single disease of a multitude of super unhealthy people, because for many, many years they've been engaging in extremely unhealthy lifestyle. You want to treat everybody of these people with a drug or with a bypass surgery or a stent, or dissecting a tumor, or using some nasty drugs or some of these biological interventions. So I think it's not fair, it's not sustainable, and there are better way to approach medicine, where a combination of these two, technological improvements and a mechanism-based preventative science, clinical, and educational systems should work together to improve health. So less people, they develop chronic diseases, and those who are unlucky for genetic reason or other reasons, they have access to free and optimal healthcare if needed. So we have lots of knowledge, should just be implemented, and more investment should go in this direction. The hashtag is Act on Health. If you like this video, just send this video to your friends and family, and thank you for listening as always. Bye.